Good morning. Welcome. It is really nice to see all of you here. My name is Michelle Erickson. I'm the Executive Director of Wisconsin Literacy and Wisconsin Health Literacy. So thank you for your patience. This all feels like new again to be doing this, the tech and everything. So we appreciate your patience, but we are really, really happy to have you here. And it is good to see all of you. And when I say all of you, I mean not just your head and your neck, right? It's really good to see all of you. But in all seriousness, we know that the last 2 years have been a difficult journey on so many different levels. And I want to just share a moment of gratitude that we are here under one roof. Thank you. Wisconsin Literacy would also like to recognize the land that we are on today is the ancestral and current home of the Ho-Chunk Nation. Though the U.S. government attempted to forcibly remove them, the nation persisted in fighting for their right to live within and protect their ancestral lands. The Ho-Chunk Nation and other 11 First Nations residing in the boundaries of present-day Wisconsin remain vibrant and strong, and we honor their history of resistance and resilience. We were uncertain when we began the planning for this, if we could gather in person, and here we are with all of you representing half of the United States of America. We have attendees from 25 different states and 1 foreign country, and fields that represent such diversity from nursing to medical librarians to adult education, physicians, health insurance, health system administrators, researchers, public health, health communicators, community-based nonprofits, pharmacists, and more. We are privileged to be here together and to try to affect positive change in our own little corner of the world. We hope you will take full advantage of this opportunity to learn from best practices, and it centered around our summit themes, which are digital communications, telehealth, health equity, and health insurance literacy. And what is so great about the work of health literacy and health equity is that at its basic core, it is about finding a better path, the less complicated way, the easier to access way, the more equitable way, the more inclusive and universal way. And this work results in a win-win for individuals and systems, for patients and for providers, for organizations and communities. You should pat yourselves on the back now for your commitment to this field and to this work. It is much appreciated, and it helps us all improve how we move through the world of health. And we all know that if we have our health, we have what is most important to living our best lives. So on to the day in front of us, and a little bit of housekeeping. Actually, there's a lot of housekeeping, but we'll get through it. For those of you who were here yesterday for our pre-summit on the vaccination community outreach, this might be a little bit of a review, but you'll probably appreciate some of it. So the layout of our breakout rooms is designed to put the health and health literacy. They cover 4 floors from top to bottom of the hotel. And if you are counting steps on your Fitbit, you're really going to love it. So to help with navigation, and because we are a literacy organization, I thought we could start with a little literacy and numeracy lesson. So you will thank me for this later, really. There are 4 words and 4 numbers that you will need to know to move through these next 2 days without feeling a little lost. So each word has a corresponding number, and while the words are on your agenda at a glance and in your program, the numbers are not. So let's begin with the numbers. You'll want to remember 3, 5, 7, and 15, okay? And their corresponding words here: 3, Mendota Ballroom; 5, the Grand Ballroom; 7, lucky number 7, the Wine Room; and the Sky Bar, 15. And we're going to add an R to that 15, because when you get in the one elevator that takes you up to the Sky Bar, you won't see 15, you'll see an R. Anyone want to guess the R? Rooftop, exactly, all right. All right, so if you don't remember that, there's cheat sheets at the registration table, and it's also in your app, so that should help you. The conference app, all right? So we're moving into more advanced digital skills, right? And the summit is really all about the importance of digital skills. And for a better conference experience, you're gonna wanna hone your digital skills and use the app. The 3 easy steps are right here on the screen. It's user-friendly, it's intuitive. You'll want to download it for sure. And all attendees are listed in the app, so if nothing else, if you get lost, you can use it to contact a fellow attendee and let them know you're still around here. Evaluations, all right, more digital skills for you to practice. On the back of your name tags, on the flip side, you'll see 2 QR codes. One is for the pre-summit yesterday, but there's another one. And you can scan this QR code, and it's okay to admit you haven't scanned much before. But you can scan your QR code, and a Survey Monkey will pop up with your evaluations after each session. We really encourage you to do that. The QR codes, you might remember for some of us, those were a skill we needed to have when we got our vaccination at some places. So it's always good to practice those and understand the challenges involved in those for all of us at different levels of literacy and technology literacy. You can also use your app, however, to complete your evaluations, and you'll be reminded in every session about completing the evaluations. We really rely on your opinion to make this conference better each time, so please help us out by completing those. And then we also hope you will post on social media. There are outlets, different outlets that we're sharing, but please post what you're learning here. Hashtag HL Summit 2022. We'll share your experience. I believe that one's on Facebook, but check out page 21 in your program to see all the different ways that you can stay connected to this conference. Continuing education credits as well. The summit offers many different continuing education credits through the University of North Texas. And for questions, you can find a contact email on the FAQ sheet, which is also at the registration table. But you can also look in page 17, I think, of your program for more information about that. And finally, I want to share immense gratitude for Wisconsin Literacy and Wisconsin Health Literacy staff and the volunteers who have been working tirelessly since last summer when we started planning for this event. I want to thank our board of directors, many of whom are here today, who have supported this work, our host partners who have promoted and shared the summit among their networks, the Summit Planning Committee and the advisory panel who helped us put all the pieces together, and the presenters from whom we are going to learn so much from over the next 2 days. At the end of the day, though, we would not be here without generous sponsors who made it possible for us to gather. Please take note of all of our sponsors on the inside cover of your program. We also thank the Wisconsin Department of Health Services, who is here and providing videography for this room, and down on 3rd floor in Mendona for the whole 3 days of our conference. It's much appreciated. Thank you. So I'm happy to welcome and introduce our co-presenting sponsors of the 22 Wisconsin Health Literacy Summit, WEA Trust, Wisconsin Education Association, and ETF, Employee Trust Funds. Melody Broughton of WEA Trust is here to share about their work and their organizational commitment to health literacy over the years. You may notice throughout this conference that you might see a lot of people with WEA Trust name on their name tag, and that's because WEA Trust truly walks the walk to become a more health literate organization. In addition to co-presenting sponsorship, they paid for 30 registrants, employees, who will benefit from this professional development and whose clients will truly benefit from the professional development over the next 2 days. ETF, another organization that walks the walk and has done a lot of health literacy training with their employees over the years with Wisconsin Health Literacy. So we're very grateful for these 2 co-presenting sponsors, and I'd like to ask Melody to come up and just say a few words about the work. Melody is WEA Trust Manager of Legal Services.
I'm glad this is not the Oscars. Good morning. On behalf of WA Trust and our fellow sponsor, ETF, I'd like to welcome you today. It is so nice to see shiny, smiley faces in person, so thank you for being here. In 2020, WA Trust celebrated its 50th anniversary of serving Wisconsin school districts and public employees. Our health plan is a proud supporter of Wisconsin health literacy, and we utilize their expertise in training our member-facing staff. We also have co-created a more literate and easier to read explanation of benefits for our members. Health insurance is inextricably linked to healthcare and patient outcomes. Research has proven that those patients who do not have or who do not understand their insurance, its out-of-pocket costs, and how it works, are often patients that have poorer health outcomes. This can result from failing to take part in preventative screenings or using the emergency room, which we know is a limited but expensive source of medical care. In some cases, we know patients delay critical medical care, leading to devastating consequences for patients and their families. Because of this, you will notice a new focus on health insurance literacy in the breakout sessions today and tomorrow. I'd like to thank Wisconsin Health Literacy, ETF, the other sponsors, and our esteemed speakers for helping us bring health insurance literacy training to you and to your staff. We hope you enjoy the upcoming sessions. Thank you.
Okay, on to our opening keynote session. Health literacy and empowering the patient of today. Ms. Emma Andrews is Pfizer's Vice President, Patient Advocacy and leading the organization's work to embed the patient perspective across all Pfizer's efforts, from bench to bedside and beyond. A registered pharmacist, Ms. Andrews is passionate about helping people live longer, healthier, and more productive lives. In her current role, Emma works with internal and external stakeholders to advance patient-focused programs across the enterprise. Ms. Andrews joined Pfizer in 1999 and has held a variety of positions in operations, research, and strategy. Most recently, she was Senior Director of U.S. Global Medical Affairs, the team lead for the Women's Health franchise. Emma began her work in medical affairs as the Regional Medical TA Lead Diversified Portfolio for Latin America, responsible for developing medical strategies and enhancing communication between Pfizer and the region stakeholders. Emma completed her doctorate of pharmacy as well as her Bachelor of Pharmacy at the Massachusetts College of Pharmacy and Health Science. A fun fact about Emma is that she's a fellow yogi, which I love, loves to dance, and particularly Afro beats, and so it's really a pleasure for us to welcome Emma here to share Pfizer's experience and how we really advocate for the patient of today. Thank you so much, Emma, for being here. At the conclusion of her presentation, we're going to have a fireside chat where we'll ask a few more questions, and we'll give the audience a lot of time also to ask some questions. So please be thinking of your questions as we go along. Thank you.
Thank you, Michelle. Thank you, Michelle, for that warm welcome. Good morning, everyone. I am delighted to be here today. This is my first in-person event in over 2 years, and it still kind of feels surreal, but in a way perfect as well, because we're here today to talk about health literacy, a topic I am so passionate about. And I also get to spend time with all of you who are equally passionate about health literacy. And like most of you, over the last 2 years, we've been communicating via screen to choose the digital platform, Zoom, WebEx, Teams. That part of me is waiting for someone to stand up and yell, "Emma, you're on mute." I'm not on mute, I'm in person and thrilled to be here. So I wanted us to take a step back and think about New Year's Eve 2019. If you're like my family and I, my husband and our 2 daughters, we were so ready to say goodbye to 2019. I mean, 2020 had this ring to it. 2020, clear, perfect vision, the year of clarity. And for us, our family, our two daughters, it was a double graduation. Our youngest was graduating from high school, and our senior was graduating from college. So we had all this excitement about 2020. What we did not anticipate is that in less than 3 months, our lives were about to change beyond our wildest imagination. On March 11th, 2020, the World Health Organization declared COVID-19 a global pandemic. I remember early March when I left my office in Manhattan, I took a couple of things saying, we'll be back in 2 weeks. Well, those weeks evolved into almost more than 2 years. So really, again, before we get into a deep conversation, I just wanted us to pause and think about this number. Really, the toll of COVID-19 has touched us all in some way or another. As of late last month, 6.1 million people around the world have died from COVID-19. And the destruction of COVID-19 was further complicated by another killer called the information epidemic, or what the World Health Organization calls infodemic. And they define an infodemic as false or misleading information in social or physical domains that, when people see this information, it causes them to take risk-taking behaviors that could harm health. And let's take a step back and think about late 2019, early 2020. I mean, on TV, we saw that, different countries around the world were calling national emergencies. It was national emergencies. I mean, lockdown took on a new feeling of what lockdown meant. And also, we know that as scientists were learning about this novel coronavirus, so much information was shared in the public. I mean, as they were learning about information, it was shared to the public. So all of a sudden, your regular citizen, your regular person had to become an infectious disease specialist, understand what transmission meant, understand what the mechanism of action of an mRNA vaccine. Were they really ready? Was the world really ready and equipped to really understand this information? That's why health literacy is so important. And I think COVID-19 even propelled it to another level. And that's why forums like this are equally important. So a lot of you who were here yesterday for the pre-summit talk, actually, by Dr. El-Sayab, this chart seems familiar. But I wanted to talk about it again today as well, to say that, late last year, actually, the Kaiser Family Foundation did this survey where they had 8 false statements about COVID and the COVID vaccine. And surprisingly, or not surprisingly, 78% of the adults surveyed believed or were unsure about at least one of the 8 false statements shared here. And to most of us in this room, I'm trying to see something actually here to most of us in this room, some of these statements might seem kind of honestly ridiculous. That a vaccine contains a microchip, that a vaccine is going to change your DNA. But really, when we think about it, and I want to share a story with you, because I'm sure all of you had these conversations with loved ones over the past 2 years. My older sister, has a master's in food science and nutrition. And she actually works with oncology patients in partnership with a few leading hospitals in Maryland. I can't tell you how many conversations I had with her, my sister who works in a hospital setting, debating these statements. And my knee-jerk reaction, I think Dr. El-Sayab also talked about it yesterday, was to dig out all the data and talk to her about why she was wrong. But then I realized that was not being effective at all. I had to go back and really meet her where she was, really understand what her fear was, around this. And I'm really happy to say that when I changed my approach to talking to her, she got it. But the even scarier thing she said, they were having these conversations in the hospital with nurses, physicians, nurse assistants. These were conversations that they were having. So again, I'm happy to say that she's vaccinated and her family is fully vaccinated as well. But I'm sure all of you can relate that we had these conversations multiple times with loved ones, peers, friends, etc. So again, I'll iterate that really the work, the Wisconsin literacy and health literacy work you're doing here and bringing us all here today is so important. And then that means that what does this mean for us as healthcare professionals? What can we do about this? As healthcare professionals, we know that good information and good health go hand in hand. That knowledge is power. And in the case of COVID-19, it is health. And I believe, and I'm sure you all believe as well, if you're here today, that one of the most promising strategies for intervention is health literacy. And I would also argue digital literacy as well. And I look forward to really discussing that as we go through my presentation. So before we jump into our conversation, I'd like to take a few minutes to tell you a little bit about myself, my role and experience at Pfizer, and share a bit about why I'm so excited about the work Pfizer is doing in health literacy, in health equity, and to really make sure that we follow patient-centric principles across everything we do. So I currently serve as Pfizer's Vice President of Health Literacy, Pfizer's Vice President of Global Patient Advocacy. Sorry, I'm so excited about health literacy. It could be health literacy too. No, as Pfizer's Vice President of Global Patient Advocacy. And really my team and I, our job, our role is to make sure that we embed the patient perspective across everything we do, from bench to bedside and beyond. But really my passion for improving patients live long and healthier lives dates back to my childhood. I was born in Uganda, and we fled Uganda when I was young during the Idi Amin days, and we resettled in Cote d'Ivoire, which is in West Africa, in Abidjan. There my mom, who's a midwife, volunteered at a public health community center. And for the first time, I really became acutely aware of the inequities when it came to access to health and access to medicines. And that really led me to pursue my education in pharmacy, where I got my Doctor of Pharmacy degree. My first, out of school, I practiced in both the community and hospital settings. And it was there that I really was dumbfounded about the low adherence to medicines, even after patients were diagnosed with a serious illness. So I was thinking to myself, what goes on then? What goes on in a patient's mind when you know you've been diagnosed with a serious illness, you're given a medication, but you still don't take it as prescribed? So then, I didn't have to dig far. I thought about my own family again. I hope this is never recorded and shared with my family, because I'm spilling all the family secrets. So my dad, sorry, Dad, my dad is an economist, and went to the London School of Economics, so really, in all intents and purposes, a highly educated man. He's 87 years old, and in good health for the most part, but then he has high blood pressure. And in the beginning of his diagnosis, he wasn't well controlled. His blood pressure wasn't well controlled. But he would read things or hear things on TV and call me up saying, Emma, I know you're a pharmacist, but guess what? I just read this, and X number of people, X% of people will get this if they take this medicine. I don't want to take it anymore. So then, again, knee-jerk reaction. I want to pull out the clinical trial data of the medication he's talking about and talk about the clinical trial, how it was done and how it was well controlled. It was a randomized, double-controlled study, after all. This is really good data. That didn't work. That didn't work at all. I had to, again, meet my dad where he was. Really, what were his fears? And really, at the end of the day, what I realized, he really didn't understand what a benefit-risk profile of his medicine was, or what really the implications were when he didn't take his medicine. So I had to put everything in context. I was saying, well, you know, Dad, from the moment we wake up to the moment we go to bed, we make, consciously or unconsciously, we're making benefit-risk decisions all day long. And I know this is a gross exaggeration, but I was like, well, Dad, did you have breakfast today? He's like, yeah, of course. I'm like, well, you could have choked and died. Did you go to the supermarket today or go visit friends? Did you get in a car? He's like, yeah. Well, you could have gotten into a car accident. And I told him, but jokes aside, Dad, I mean, it's nice that you brought up this question. And really what I'd urge you to do is that at your next well visit, have these conversations with your physician. Make sure that you ask these questions and really keep asking questions until you get an answer that you can understand and you're comfortable with. And, you know, all of us today here, again, we made a benefit-risk analysis of whether we should be here today. And I think for most of us, the benefits outweigh the risks, and here we are. So again, we have to remember when we're talking to people who might have hesitancy, people who might be afraid of taking their medicines, people who might not understand why they've been prescribed these medicines, to really meet them where they are. And those are key takeaways that I think about. And then bringing us back to then why I'm here today is that really then just those thinkings and thinking about my own family, that's where my passion for health literacy was born. And that's why I keep saying this, I'm so excited about the work you're doing here and the fact that you're all here because there's still a lot of work that needs to be done in this space. And so, you know, an important first step really is defining our terms of health literacy. And again, we all know that health literacy is not to be confused with literacy. I mean, look at my dad, highly educated, and yet he had problems understanding, he was actually health literacy challenged. Someone with low literacy, whose physician, healthcare provider, has taken the time to explain their diagnosis to them, to explain why they've been prescribed a medicine, will probably have better health literacy than my dad did, that will lead to activation and lead to improved patient outcomes. So really when we think about health literacy from a patient perspective, it's the degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions and actions. From a health system perspective, it's the degree to which organizations equitably, and I'm going to say equitably, enable individuals to find, understand, and use information and services to inform health-related decisions. However, I particularly like the Healthy People 2030 health literacy definition that really puts the onus on society to provide accurate health information and services that people can easily find. So it's up to us, it's up to organizations to really make sure that we provide people with accurate health information that they can easily find, understand, and act on. I particularly love this quote by Caroline Clancy, which really challenges us all to tackle health literacy. And it really alludes to the idea of a universal precautions approach to health literacy, which means that we need to treat all patients as if they're at risk of not understanding health information. We as healthcare professionals in the public health space, we cannot look at someone and know whether they understand or not understand the information we're sharing with them. So really we have to assume that they're not equipped to understand the health information that they're met with. And I also like this National Assessment of Adult Literacy survey that was done in 2003. And I'm almost perplexed that really 2003 is the last time we did a national assessment on health literacy. But really, regardless of that, maybe that's a call to action, that maybe we need another national assessment to be done. But really, regardless of that, when you look at the survey that was done, they're basically they categorize the data into four categories of groups. And I'm really not going to belabor this or go really into this too much, but really to me, the four categories were below basic, basic, intermediate, and proficient. And the alarming thing for me is that really 12% of the population was considered to be proficient in health literacy. That's really a public health crisis. And I think if you think about COVID, what happened with the COVID-19 pandemic, I don't think this is either the same or actually even gotten worse. So that means really we have our work cut out for us in this space. And also, we know that low health literacy is present across all races and ethnicities. But however, we do know that one additional finding by this report about the disproportionate levels of low health literacy among ethnic and racial minorities. For example, 28% of whites had basic or below basic health literacy skills compared to 58% of blacks and 66% of Hispanics. So to me, what that really means, that low health literacy is very much tied to health equity and very much tied to health disparities. We really need to do, by improving low health literacy, we can really help close the gap when it comes to health inequities and health disparities. This is another chart that I really love, especially it took a lot to educate even my own Pfizer colleagues around what health literacy meant. Because for a lot of colleagues, they thought, oh, well, health literacy and literacy are the same. It's really a developing world issue, doesn't affect people in the developing world, in the developed world. Well, we can see that developed countries here, like the European Union, Australia, and the US actually have a high prevalence of adults with limited health literacy. So that means that we need to start to think about health literacy, as I mentioned before, in the context of health disparities. It's not really about, and the good thing about, to me, when I think about health literacy, is that it's a modifiable risk factor. Unlike literacy, where the person actually has to learn how to read and write, talking to a person in a manner that they can understand, using clear health literacy principles, can really make a difference and lead to patient activation and for them, and hopefully then improved health outcomes. I won't spend a lot of time on this slide, but really it goes without saying when it comes to thinking about the negative effects of low health literacy. It's obviously associated with unsafe and inappropriate use of medicines. If you don't understand why you're taking the medicines or how you should take them, that will happen. There's data to suggest that there's greater risk of hospitalization, rehospitalization within 30 days of discharge. There's higher utilization of the emergency care, again, because you're not really understanding what your diagnosis or where you should go, or even how to access health care for preventative care. And there are poorer health outcomes, and unfortunately a higher mortality rate, especially in older adults. And then obviously poor adherence, which again leads to worse health outcomes. And I particularly love this slide when we talk about the three core principles of health literacy that are readability, understandability, and actionability. So again, what is readability? It is really when we write a text at an education of a grade level that a person will be able to easily read. And then understandability is then you take it a step further, that yes, they're able to easily read it, but can they process and explain key messages? And then actionability, then you take it another step further. Okay, yep, they can easily read the text. They can now process and explain key messages. But then actionability, what are they actually going to do based on the information presented? And a lot of times, we either take a piece of one of these things and think, oh, we've done health literacy. Like before we started this process at Pfizer, people were like, oh, but all my information is written, all my consumer-facing information is written at a third grade level. That's not health literacy. So what we're committed to doing at Pfizer is that we continuously strive to incorporate all these core principles of health literacy in our patient and consumer-facing materials. So in the next slide, I'm going to talk to you a little bit about our legacy in health literacy at Pfizer and talk a little bit about our timeline of things we have done in this space. I'm not going to talk about everything on this slide, though I'm really #Pfizer proud about everything we've done here. But I'll spare you. I'll highlight a few things. In 2005, we actually funded the development of a leading health literacy screener called the newest Vital Sign. And this is a tool that researchers, healthcare professionals can actually use to quickly assess the level of health literacy that their patients have. And I'm happy to say and proud to say that it's still widely cited in health literacy publications. And then in 2013, our health literacy efforts were recognized by the Institute of Medicine. And in 2018, Pfizer actually joined and is now a proud sponsor of the National Academies of Science, Engineering, and Medicine's Roundtable on Health Literacy. And my colleague Anne-Louise Assaf actually represents Pfizer on this roundtable. Also in 2018, finally, what I'm really so proud about it is that, our clinical trial data, we're continuously striving to make sure that we write it in their plain language summaries that accompany our clinical trial data. And also that our abstracts that are published also have accompanying plain language summary abstracts. It's not perfect yet, but we're making great strides in definitely getting there, because really at the end of the day, we have to be able to explain our clinical trial data, the work we do in a manner that patients can understand, especially clinical trial participants who have taken the time to be part of our clinical trials. We have to be able to explain the data to them in a manner that they can understand. And then another thing that I'm really proud of as an organization is that we've created a health literacy training module for our colleagues. So now everyone who is creating patient-facing, consumer-facing materials has to take health literacy training. We also have a health literacy automated assessment tool that colleagues can quickly use to really find out whether the materials they've created actually follow health literacy principles. And another thing that I'm so proud of is that last year, for the first time ever, we published Pfizer's position on health literacy and patient activation. And that's a position paper, and that's now available on Pfizer.com. And then also another thing we do is that we partner with academic centers, universities, to help us really inform our health literacy strategies. With Northwestern, for example, we partnered with them with health literacy experts there to really help inform our health literacy strategies at Pfizer. And then our clinical trial group at Pfizer also recognizes that really we need to diversify our clinical trials. We need to make sure that our clinical trials represent the communities in which they're carried out, and really, we enroll everyone, make sure that we cover all populations. And they've partnered with Harvard University and the Multi-Clinical Trial Group Center to really make sure that our clinical trial information follows health literacy principles. And that will bring me back to COVID-19 and what did Pfizer do during the pandemic. So I'll talk a little bit about our pivotal trial, our COVID-19 pivotal trial, and why I'm so proud of the work our clinical trial group colleagues did. So for this landmark phase 3 clinical trial, we enrolled over 46,000 participants at 153 clinical trial sites around the world. In terms of participant diversity, approximately 42% of the overall and 30% of US participants had diverse backgrounds. When we looked in our focus in the US, when we looked in the US, I'm proud to say that for African Americans and blacks enrolled in our studies, they were at census level. For Hispanic participants in our clinical trials, they actually exceeded census level. And for our male and female participants, they were at census level. So we've said, and in order to do that, actually, we had partners. So in the US, we partnered with the National Hispanic Medical Association Board, and we also partnered with the Black Nurses Association. And really, those two partnerships were really pivotal in that they helped us really understand and co-create with them materials that were culturally appropriate for their constituents. And that really made a difference. We also translated all our clinical trial materials into Spanish, Haitian Creole, Tagalog, Simplified Chinese, Japanese, etc. And again, we all know that it's not just about translating materials. The translation actually adds another layer, because then you have to make sure that what you have translated, again, follows health literacy principles. So we've really taken all these learnings that we learned during the pandemic and said, okay, we've been working at really diversifying our clinical trial population, make sure we include everyone, especially for COVID-19, it was really pivotal because the minority populations that are usually not included in clinical trials were the ones that were disproportionately affected by COVID-19. And really, at the end of the day, we have to acknowledge the skepticism they have about being in clinical trials because of the systemic racism of the health systems that they live in. So really, it's not surprising that they were hesitant about being part of clinical trials. So really what it took is making sure that we had the right partners, and we partners, and we also met these patients where they are, making sure that we partnered with people they trusted to share this information with them. And those are key learnings that we're now taking and saying, okay, how can we build on that? And how can we improve on that? And another example that I wanted to share is our COVID vaccine education and equity project and our Better Tomorrow initiative. This is really an example of how we are using clear and accessible language to share key health information to patients. And also our Better Tomorrow initiative, which really, again, is really committed to making sure that African Americans, Latino, and Native Americans have the information they need, that it is culturally appropriate, and that we're meeting them where they are. And before I end, I just wanted to say that the pandemic has changed so much for all of us, from how we from how we communicate, where we seek medical information, to how we interact and meet with our healthcare professionals. And it goes without saying that digital technology, we always knew that digital was here to stay. But I think COVID-19 accelerated the pace of how we're using digital technology. I'll give you another example, and I'm sure we can all relate to how, first of all, we all had to use a digital platform to enroll, to get a vaccine, to schedule a vaccine. But I'll give you an example, again, family. So my in-laws and my parents are retired. So what do you do in retirement? You travel. So as the world opened up, I don't know how many of you have ventured outside the US after the pandemic and after borders have opened up. It is completely, even for me, a little intimidating. I know when we had to travel to Scotland for my daughter's graduation from her master's program, not only do you have to access a platform to find out which different countries had different requirements for COVID-19. Sometimes you have to schedule a test ahead of time before you come. And by the way, you need to load all this information on a passenger locator form before you're even allowed to board a plane. So when my in-laws and my parents thought about this, they're like, you know what, we're good. We're good for now. We're gonna stay in the US. So really what I have to say is that all of us, listen, digital is here to stay, but all of us, I'm looking at myself, we're out there creating digital technologies, digital solutions, we have to be sure that we are not widening the digital divide. What are we really doing to make sure that, yes, technology is here to stay, but are we having these conversations with our patients to understand where they are when it comes to digital technology, and making sure that the solutions we're providing are not further widening the digital divide? So again, I cannot thank the organizers enough to have had a forum like this where we're all coming here to talk about it. We all know, and what COVID-19 has actually shown us, that this is more important than ever. We still have a long way to go to tackle health literacy. And I want to thank you all as well for being here today, taking time out of your busy schedules to really be here. And thank you so much for having me here today. And I'm looking forward now to a conversation with Michelle and answering any questions you may have. Thank you so much. You might have one there. Is it on? Yeah.
Is this on?
Yeah.
All right, here we are. Okay, so Emma, you just spoke a little bit about this at the end of your talk, and I think about this a lot in our literacy organizations, Wisconsin Literacy Support 70 community-based adult literacy programs, and what happened during the pandemic in terms of really flipping the whole model of adult delivery education to a virtual model. And it wasn't just our students that had never been on a Zoom meeting or attended class via Zoom or used their cell phone and WhatsApp to get messages from tutors, but our tutors themselves were realizing how the digital skills were beyond what they had experienced. We have a lot of retired citizens who are volunteers in our program, so that became a really big barrier. So I wanted to just talk a little bit more, and this, I'm talking in general literacy and digital literacy, the transition during the pandemic from showing up at your local literacy agency and meeting your tutor in person and learning together at a table to figuring this out digitally. So I wondered if you can talk a little bit about that connection between health literacy and digital literacy, and then also some of the barriers that patients run into as they look at what's digitally required now just to get by in our world.
Yeah. No, thank you so much. And you know, I always struggle with this because when we talk, you know, we have all these things, there's health literacy, digital literacy, financial literacy, all these different literacy things. But when we think about health literacy and then we think about digital literacy, at the end of the day, we're still trying to convey health information, but the platform with which we're using is digital now. So but it's the same thing, but now we have another layer on that. And that's the platform, that's the digital technology that we're using. And a lot of the times, I'm going to focus in on the US because obviously when we go ex-US, they're different issues altogether. But in the US, the way it's connected really is that one thing we have to do is really embrace digital. I mean, it's here to stay. There's some amazing, really great things that happen that technology has really provided us. But we have to recognize that when it comes to sharing health information, and when we're thrown into a pandemic where, you know, for elderly sometimes, you know, if they weren't really familiar, didn't really want to use digital technology, we would give them paper. But now they couldn't come into the office and we couldn't give them paper. And now all of a sudden we were expecting them to either call us, or by the way, can you use FaceTime, or do you have a computer where you can zoom in and I can see you? This was all new to them. The end goal was really that we wanted to share health information, but it's that technology. And in the US, you know, I've heard arguments, and some of them are really real, that, you know, do people have access to Wi-Fi? Do people have access to even a computer? But sometimes it's even beyond that. Do they know how to use the technology? They might have Wi-Fi, they might have all this. My mother-in-law, they have Wi-Fi. She still does not like using the computers at all. My mom, literally,
answering the phone. Mom, the green button. There's so many phones we bought her. Mom, press the green button to pick up your phone. The green button, not the red. So, so we just really have to understand that it's not just about even access to Wi-Fi or having access to the technology, it's how to use the technology. And I think when we have, like I mentioned, when we're creating these digital tools, because we have to embrace technologies, there's some positive things about technology, quite frankly. We have to simply have that conversation, ask that question to your patient. Do you know how to use X, Y, and Z technology? If not, we're going to have to actually build it in. We're going to have to build it in and train, make sure that whatever the office setting is or whatever the setting is, that there's a way we can really train our patients to use this technology. Because, sadly, this is not going to be the last pandemic. And quite frankly, we can sit back and say, okay, we got through this. What are the learnings? And are we really ready for the next one?
I want to engage the audience a little bit. I know that we have presentations and breakouts that are going to be dealing with telehealth. So when you're talking about which buttons to press, that becomes really imperative when you're trying to see your doctor for a visit and it's through a screen. So I wonder if anyone in the audience wants to share, or any of our presenters that have, and we're going to get this extra microphone in, a runner from Wisconsin Health Literacy in a second. But I wonder if anyone in the audience would like to share if they've been involved in digital health, telehealth, which we know is not going away, and health systems. Obviously, for them, there's a huge benefit in terms of telehealth visits and the efficiency that comes with that for their providers. So can anyone share some of the barriers that you've seen as a provider or an observer in health systems around the digital skills required in telehealth? Or any other digital requirement within health? Okay, we've got one here and one there next. Thank you.
I see a lot of assisted living.
Just a second. She's going to get you the mic so they can hear you on the recording.
Hi, this is Jessica. I have seen a lot of folks in assisted livings that have real difficulty with getting to appointments. They are the folks that I think struggle the most, and there is no family member sometimes that can come in and help them with a device. Staff members don't have the device nor feel like they're personally responsible for this person, to act. Some of them do, but some of them don't. Transportation gets in the way. So I think assisted livings are a big area that we kind of need help as a society to do virtual visits, because not only physically is it hard for them to get to appointments, but digitally they have no help and no support. And they're risky.
Thank you. Yeah, absolutely.
We have a few hands.
Okay, I'm torn. I saw over here first. So.
Hi, I'm a doctoral student in counseling psychology, and so I'm a therapist, and I predominantly work with college students. And I think the issues that I've seen there are two major issues, one of which for college students who are living in dorms is not having access to private spaces and not feeling like they can actually engage in psychotherapy, and that being something that poses a challenge for them. And then largely, while we were working on social distancing, not being able to access a place that they could be safely heard. And I had people logging in to do psychotherapy from their cars, and so it's something that I think made it particularly challenging to be a provider in that sense. And another issue that comes up in the field of psychotherapy is noting that with our laws and ethical regulations that our clients have to be in the same state that we are practicing in. And so oftentimes there'd be people who'd be out of state and we'd have to tell them that we were not able to provide care. And I think that also comes down to a literacy issue where they just didn't know that that was something that they needed to be aware of, and really prevented access to care for a lot of folks, especially in the height of COVID when college students were returning to their hometowns and states. And so, yeah, I think it's also a literacy issue in that sense as well.
Thank you. One more over here in the, yeah.
Hi, I'm Angela, and I just think that rural Wisconsin doesn't have a lot of access to Wi-Fi. My father-in-law does not have a computer, does not have access to Wi-Fi, and was not able to be seen because he didn't have any devices to meet with his doctor.
Thank you. Yeah, even sometimes when we have the digital skills, we might not have the broadband or the Wi-Fi, and often sometimes when we have the broadband and the digital skills, we don't have, I mean, when we have the internet and broadband access, we don't have the digital skills. So yeah, you can get hit on both sides. Okay, any other barriers that come to mind to you, Emma, around the digital literacy connection to health?
No, I think all the barriers have really kind of been identified here, but I want to take the onus back on us. I mean, and really we really need to continuously find ways to make sure that whatever tool, because like I said, digital is here to stay, but being part of an organization that develops a lot of digital tools, we have to be cognizant of the barriers and make sure that we're not further widening the digital divide. So there's simple steps that healthcare professionals, organizations can take, simple questions you can ask to make sure that when we develop solutions, we're not further widening that digital divide.
Okay.
Oh, you had a question? Sure.
We're gonna stop you just because we can't hear you
Can you raise
until
your
we
hand?
get you a microphone. Thank you.
Sure.
With all of the things that we're talking about, I can't help but think, are healthcare systems too complicated in general? And is that where we start? Like when we're talking about mental health and not being able to see someone out of state, could we broaden that in some way?
Yeah.
Is that where we start with a solution? There is a large waiting list for mental health.
Yeah. That,
Think-
you know,
So the systems and the processes
the
in
policies,
general and policies,
the
red
policies,
tape.
the red
right?
tape, exactly. So, I mean, for example, why is it that if you are licensed in one state, you actually can't treat your patient if they live in another state? That's a policy issue. So really, again, it's all of us to sit down and say, the pandemic has kind of really shone a light on how complex the health system is. And not only just in the US, quite frankly, I think it was everywhere that really there's room for improvement. There's some countries that have actually quite really good health systems when I think about the Nordic countries, for example. But I mean, you know, there's still complexities in a lot of health systems around the world. So we really have to sit back and say, what has this shown us? And what are those preventable deaths that we could have prevented if we had a simpler health system? And look at the policies in place as well. I know you have a question as well. Yeah.
Can we speak about, sorry guys. Hello everyone, my name is Kim. When we speak about how do we even build in the equity that in clinical settings that exist, that we need to put in place because of the hardship it is for patients to understand and learn and figure out what their conditions are. We really have seen with the pandemic being as extreme as it has been, utilizing community health workers to assist physicians and clinicians in sharing knowledge with patients in an equitable way that they sort of get it because they have the time to spend with them. And that's one way we've been able to bridge some of the gaps because community health workers are people that have been utilized in different countries and different settings many, many years. But now we've seen such a resurgence, and I know everybody dislikes the buzzword now, community health workers, but it's a part of a community I've been with for over 11 years now. And knowing how impactful that has been in the literacy arena because sharing information in a way that people get it. Like you said, I want to call you Dr. Andrews, like you said, that's what I want to say. Yeah. But like you had spoken about with your dad being as elevated in knowledge as he was, you still had to meet him where he was. But not everybody has time. You know, but community health workers have been utilized in that space because of the time element and that shared experience to be able to provide that information so people understand and are able to do what they need to do to take care of themselves.
That is such an important point you bring up. I mean, we really forget the important work community health workers have been doing all along. In fact, who did we partner with when we needed to engage to make sure that the African American population was really enrolled in our clinical trials because they were disproportionately affected by COVID-19? We partnered with community health workers because they were a trusted source of information. And then coming back to the complexity of health systems, when we think about it, quite frankly, how much time do you have when you meet with your doctor? 5 minutes? So really, and it's not really their fault if you think about it. 5 minutes with your doctor, and in those 5 minutes, he has to explain to you the benefit risk profile of the medicine he's prescribing, and by the way, explain your diagnosis to you in a manner that you can understand. So really, our role as healthcare professionals, our role as organizations, is to make sure that we equip our physicians with tools that they can easily use and say, okay, well, I have a constrained time, but what can I say? How can I use that time effectively to make sure I'm following health literacy principles in those 5 minutes I have with my patient? But thank you so much for raising that. There's so many questions.
Okay. Okay, we're going to take a couple more questions, and then we're going to move in. Kim, you kind of led us into the equity, health literacy, and health equity connection, but we'll take a couple more questions over here in the corner, and then. Yes, I'm pointing at you. You've had your hand up for a long time.
Thank you so much. I wanted to bring up the idea of the tech in general, of making the assumption that the tech works or tech works well. I know just in my own life experience, like I've stopped doing the pre-check-in on the app because when I go there, they still make me fill out a piece of paper. Or when my dad was seriously ill and in the hospital, and I was seeing the updates in his account, which took me forever to figure out how to get into with a master's degree. But I was then having to call my mom and be like, I think he has this, because I could see what was being uploaded in the app in the emergency room before he found out about it. My mom stopped filling out an intake form for the dentist because it asked her if she was female 3 times, and she thought she was filling it out wrong. So I think that's an important thing to think about is, A, do staff know how to use this tech? Are there bugs in the tech? I think that a lot of the problem isn't on the humans that are people we're talking about, but also that people aren't trained to teach people, and these systems aren't always intuitive. So I just wanted to bring up the tech issue that I experienced.
And that's a really important point, because I always ask myself, even myself, is that why is it that with different doctors, I still have to access different healthcare portals? Why can't we have one portal? So then that comes back to how complex our health system is, you know? So now, not only do we have that digital barrier, but guess what? Depending on who you're visiting, you're going to have to fill up this information 10 times because they all have different portals to access your health information.
And you have to check if your insurance provider supports that care as well.
Yeah.
Okay. Conveniently, I want to just pass the mic over here. I don't know if
Go
there's
ahead.
anyone. Okay, great.
My question is, I really appreciate your passion for health literacy. What can we do with policy? I'm going to broaden this a little bit because we know that many people rely on Fox News and other false information. This is a real struggle. How to change that message, and that's beyond what we individuals can do in our communities to fix this problem. So I'm wondering what corporations such as Pfizer is doing to help lobby for this with politicians and the policy people about, yeah, we got to change our healthcare system. We've got to advocate for this health literacy need.
So I can't really speak to the work that we're doing in the policy space because that's not my arena, but I know my policy colleagues do a lot in terms of policy work. But what I can say is actually our speaker yesterday, I'm not sure whether you guys were here, really talked about the art of communicating science. And he really was interesting because, listen, this infodemic is here to stay. I think COVID-19 really showed us that really, I mean, the amount of false statements that were there that people actually believed is here to stay. So our work, especially if you're in the work where you're interacting with the public, honestly, is to really meet the people where they are and understand why they have the fear. When I think about my African American brothers and sisters, why are they skeptical about being in clinical trials? Well, their skepticism is actually founded in reality. You just have to look about the transgressions that were done by the medical healthcare system. Meet them where they are, and then talk about what you were doing and why it's important that they be part of this clinical trial. The news, the misinformation on Fox News, you can't really, I mean, this is the land of, in the United States with freedom of speech. But then the thing is really then to meet people, when you're having a conversation, some people you'll never be able to change. I have to acknowledge that. But for the most part, it's just like meet them where you are, and rather than going to my knee-jerk reaction, I'm a researcher, I want to go back to the data and pull it out and say, but I have this, I have that. That's not going to work. You really have to understand, why do they really believe this? Why do they gravitate to Fox News? Who knew that the COVID-19 vaccine would become a political issue? Who knew a vaccine, like people would question science? So I mean, I think it shows the times that we live in. But again, to me, we have to learn to talk to each other, not over each other, and really meet people where they are. I really go back to that.
So I want to take that just a step further about the connection between health literacy and health equity and where we are with that.
Yeah. Wow. I think I alluded. That's a really loaded question. And really, listen, even when you looked at the national survey the assessment that was done in 2003, we showed that really low health literacy affects all races and ethnicities, but really we saw the numbers that were outstanding, that it affects minority populations, I think 58% for blacks and 66% for Hispanics. So then to me, low health literacy becomes a health equity issue. You know, becomes a health inequities issue and a health disparities issue. I don't think you can separate the two of those. They go hand in hand, quite frankly. I'd welcome other people's thoughts on that as well.
We're going to need you on the mic just a second. And then there's a break in the way back to Julia after this question.
I think there's also correlations between the technology that they have access to and what they have access to.
And also, not only technology, when we think about our digital platforms, you then think about, are we equipping our patients and public with tools where they can decipher fact from fiction? So think about it. That's one of the problems, really. Are we really making sure that we're equipping them with health literacy tools, digital skills that really can help them decipher fact from fiction in this infodemic era we live in? There's a lot of work to still do in this space.
Absolutely. Hi, my name is Alex Carlson, and I have a question. We keep on hearing the term culturally appropriate. And I guess I'd like to have that defined, and beyond universal precautions when we're working on resources and translating, what defines culturally appropriate, and to what degree do we have to alter resources to make them culturally appropriate, or know if they are?
Again, really loaded question, but I'll attempt to answer it. To me, quite frankly, it's simple. Think about the population you're targeting. Then go to that community and co-create those materials with them. Simple. Representation matters. So co-create those materials for the population you're targeting with that community. Then they'll be culturally appropriate.
One more question.
I have two quick questions. The first one is, you explained that some of how you, because of historical mistrust, there's been, lack of representation in clinical trials. And I know that you said you've worked with the Black Nurses Association and the American, or like the
Hispanic Medical Association.
Yes, thank you.
Yeah.
And is that in all of your clinical trials going forward, or was that just COVID?
No. So actually, again, I have to give props to my clinical trial colleagues that this is year after year, they've been really trying to chip away at this. It's not an easy thing to do, especially in the United States with a history. But COVID-19 really propelled us to where we are, and we had such success in the clinical trials, not because it was just COVID, but also the years of work they'd been doing in this space. But especially for this one, there was such a profound need to ensure that our clinical trials enrolled minority populations, especially African Americans, that were disproportionately affected by COVID-19, as well as the Hispanic population, that we knew this was urgent. I mean, these were lives that needed to be saved. So then those partnerships were, again, we already partnered, they were partners before, but this was even more profound and also showed us that we went a step further in terms of the co-creation of the materials, making sure that the public service announcements were actually in newspapers where the populations we're trying to target were, making sure that we actually worked with community leaders to deliver the messages and not us. So there were things that we kind of knew that were in the works and we're doing, but there's so many lessons learned that we're taking from this and moving forward. But it's not just a one-time thing to say, oh yeah, we did it. This was years of work that my clinical trial colleagues have been working on. And it was really nice to see the success we had with COVID-19. But really, I'm hoping we build on that success to make sure every clinical trial has that success in terms of having clear representation in diverse races in our clinical trials.
Yes, and then the second one was, I see that Pfizer is doing a lot of great work in health literacy. Do you think you guys are kind of like a front runner in that, or is the industry as a whole really moving towards health literacy work?
Well, I'd like to say we're leading the conversation, but really not just us. Really, I think Merck is doing incredible work, and we have great partners. Being part of the National Academies of Science, Engineering, and Medicine's Health Literacy Roundtable, actually, we have a pharma roundtable where a lot of other pharma organizations actually sit on the table. And so really, it's not just us, but it's nice to know that we are all really, really invested in this. I always say that, you cannot be in the business of making sure that we're bringing breakthrough medicines and vaccines that change patients' lives, and not be able to speak to patients or offer tools that physicians, healthcare professionals can use to make sure that they talk to patients in a manner they can understand about the benefit-risk profile of their medicines. So this is something that is not a nice to do, quite frankly, it's a need to do.
I'm going to throw in Lily as well, who's a sponsor here, but also has been in this field and at these health literacy conferences for years supporting this work. So it's great to see this come along the way as it has. We just have a few minutes left, and I want to get just our last question and to allow the audience to engage as well. But what do you think are the most important actions? You just spoke of a few, but healthcare organizations can do to begin or to continue their journey to becoming a health literate organization?
I think what I can do is just reflect on what I think Pfizer needs to do. I think years ago we recognized that even within our own organization, our colleagues didn't really know what health literacy was. They really didn't even know the difference between health literacy and literacy. So for us, what was really important, number one, is to raise internal awareness around health literacy and make sure that all our colleagues who are responsible for developing content that's patient-facing or consumer-facing take health literacy training, and to make sure that the materials they create follow health literacy principles. And that means that we cannot create these materials in silo. If you're really following health literacy principles, you need to embed the patient voice. You need to hear what patients are thinking about these materials. Again, around culturally appropriate. Are we co-creating these materials to make sure that they're culturally appropriate? Are we thinking about the target audience and co-creating these materials with them? So I mean, to me, that's why I love my job. I actually pinch myself every day. I can't believe that my job is really to ensure that at Pfizer, my team and I are responsible for making sure that we embed the patient perspective across everything we do, from bench to bedside and beyond. It's not at the point of when the drug is on the market. It's right at the bench, at discovery. Are we embedding the patient voice? During the clinical trials, are we embedding the patient voice? When we are launching a product, are we embedding the patient voice? When the product is launched and we really looking at patient outcomes, are we embedding the patient voice? So it's across the continuum of drug development.
We have a question
So many
here.
questions.
Okay, a couple there and one up here in front. Yep, go ahead.
Hi, Emma. Good to see you.
Hi, Yinka. Nice to see you. Familiar face.
Yeah. Okay. Olayinka Shinyobola, and I wanted to bring up something that I think is very important to mention about the link between health literacy and health equity, which is trust. In advancing health equity, which I think is the responsibility of every organization, whether it's a health system practice or clinic, one of the things that is important is we need to think about using health literacy as a lens to build trust with our communities, because it's not just about providing the information, but in the way we've provided information, have we acknowledged the lived experience of that patient? Have we respected their wishes and their opinions about whether they want that treatment option or not? And so it's important to not just think of trust, but think of how we as organizations are trustworthy, and have we had the stance of patients seeing us as trustworthy. And so I wanted to bring that up as trust is important, but most importantly, are organizations seen as trustworthy? Health literacy is a way to do it.
Yeah, that's a really good point, and I actually have nothing to add. So I know Yinka. I met her on the National Academies of Science and Engineering and Medicine's Health Literacy Roundtable. So yes, from a fellow expert, absolutely agree with you, Yinka, nothing to add. Trust is so, so important. And again, it goes again to what I said about meeting the patients where they are, or meeting people where they are. And in our case as well, quite frankly, it's making sure that we're co-creating materials with a trusted source that these communities trust. Maybe hearing from Pfizer is not the best thing all the time. We have to meet patients where they are and go to where they feel they can trust the information they're receiving.
Okay, one more question, or a couple more questions there, right next to you, Julia, and then up here in front.
Hi, as we're talking about digital literacy and healthcare literacy, the Digital Equity Act has just been passed, and there's billions of dollars coming to every state. So I would like your thoughts on how do we, you talk about meeting people where they are. So how do we meet the decision makers who are doling out this money to let them know how important digital skills are to our patients that we serve? And that this is, broadband is important, devices are important, but also skills. So any thoughts about how to help them understand the importance of that? I think a lot of times decision makers think digital literacy is coding. It's not coding, right? I mean, it could be, but there's how to turn on a computer, how to get email. So how do we, any thoughts about how we talk about that?
That's really, again, difficult in a sense, but really we have to look at who the decision makers are and make sure that we're having conversations like this with them. Because a lot of time, they might not even be aware about, quite frankly, what health literacy is. Or quite frankly, that there's even a difference between health literacy and literacy. And not even understanding by having now this digital literacy or digital platform which we're using to provide health information following health literacy principles creates another layer. So really, how can we create opportunities like this to have conversations like this with decision makers, with our legislators?
I just want to add that one of Wisconsin Literacy's 4 focus areas, one of them is around advocacy, and for those of you who are representing literacy agencies or other agencies as well, but to be able to advocate for the work that you're doing every day in your literacy agency, teaching these digital skills to adults who might not access them anywhere else in their lives is extremely important. Teresa is from our partner agency in Minnesota, Literacy Minnesota, and North Star Digital Literacy is something you'll be able to learn about later, but I know that literacy agencies are at the heart of building those skills, and often legislators, policymakers, they're not always aware that this kind of learning is going on in community-based organizations. So I think it's really important for all of us to think about how we communicate that information to what we are doing every day in our work in various community-based organizations and adult education. I think that's the heart of where digital skills right now for populations that don't have access often is really happening. So talk about it in your communities and often and loudly. Okay, we have one more question here, and I think we're going to have to wrap up.
Good morning. I have a story to tell.
Love stories.
I'm a community health worker, and I help people recover COVID. And my very personal story that I encountered, I have a patient that got COVID a year ago and then has not recovered yet. And my problem was I know that we have a lot of educator, health worker here, and I just want everybody to aware of that. I'm looking for information to help my patient, my clients, and I got denied. I'm looking for information to help support my COVID patient that has not recovered from COVID a year ago, and I got denied from the hospital. I mean, the information I'm seeking for. So, as a health literacy, what can we do to educate the health provider that whoever is seeking for help, they have to find a help to support those people who need it, especially the community of colors.
Thank you so much for sharing that story. And I think for the healthcare professionals in this room, I hope we all recognize that really working with community workers, working with health literacy experts, we should look at that as partners. At the end of the day, what do we all want? We want to make sure that we improve patient outcomes, right? So it's going to take a multidisciplinary approach to make sure that our patients have improved outcomes. And some of those, especially what COVID has shown us, some of those partners might be partners we were not thinking of as part of the interdisciplinary medical team. But really now, health literacy experts, community health workers should be part of that team in order to help us really improve patient outcomes. Thank you for you sharing your story.
Okay, well, we will close here. I want to thank Dr. Emma Andrews for just a wonderful insight in terms of the work that, in the passion that you bring to this work and this work at Pfizer. And thank you so much for sharing it with our audience. Thank you all for engaging. We will have a time for exhibitors next, and then the sessions, some breakout sessions this afternoon. So enjoy the rest of the time, and we will see you at lunch in this room here at 11:30, I believe. So thank you again, and thank you, Dr. Anderson.
Thank you all so much.